Hello, my name is Susan Galandier. I'm a colon and rectal surgeon and work at the University of Louisville in Louisville, Kentucky. In this month's issue of Mayo Clinic Proceedings, you'll find two articles focusing on electronic cigarettes. One by Dr. Kadampani and colleagues, which focus on using the preoperative period as a teachable moment to try to get people to consider quitting smoking. The second is a concise review by Dr. Ebert about electronic cigarettes. E-cigarettes, or electronic cigarettes, are also known as electronic nicotine delivery systems, or ENDS, and have increased in popularity over the last several years. So much so that Oxford Dictionary just recently made vape its word of the year, vape as to inhale vapor from an electronic cigarette. We all want to have our patients quit smoking due to many complications due to cigarette smoking. And in the article by Dr. Kadampani, he and his colleagues interviewed current smokers and asked them about the possibility of using electronic cigarettes to quit smoking. They found that those individuals who had not tried electronic cigarettes were more ready to accept this concept. I have several problems with their study, one of these being that in most practices, patients are seen by the anesthesiologist a week or two before surgery, and one questions if patients were able to quit smoking, whether this would be a long enough time before surgery in order to have any meaningful reduction in postoperative complications due to smoking. Secondly, although respiratory and wound complications are the main complications we see in patients who are smoking and undergo elective surgery, although respiratory complications would definitely be decreased in patients who switch to electronic cigarettes, because electronic cigarettes are, one is inhaling nicotine vapor, one questions whether there would really be a reduction in wound complications, since the vasoconstrictive effect of nicotine would still be present. The third problem with this study is that patients, when I see them at least preoperatively, are so nervous about surgery they forget almost everything I tell them, and I wonder if this is the best time for patients to be receptive and retain what you tell them about smoking cessation. In Dr. Ebert's study, he provides a somewhat negative, concise review about electronic cigarettes, focusing on many health concerns with respect to these products. Cigarette manufacturers have themselves labeled these products with many warnings. The World Health Organization has also issued a warning about concern about these products, and many of these concerns are due to not only the nicotine vapor within the products, but due to flavorings and other products that are added to these products. Many are also concerned that because of the flavorings that are added, as well as the glitzy marketing campaigns devoted to electronic cigarettes, that companies that make these products are actually marketing or focusing their marketing campaigns toward young people. I treat a large amount of patients with Crohn's disease, and in that disorder, cigarette smoking is known to have a deleterious effect or effect of worsening symptoms. So smoke cessation is an important part of my practice. I have noticed that many patients are unable to quit smoking using conventionally available products such as varenicline, and electronic cigarettes have enabled some of my patients to successfully quit smoking. I think we have to realize that there is not a one-size-fits-all with respect to quitting smoking, and I think there is a use for electronic cigarettes in our armamentarium to help patients quit smoking. I think we have to ensure that these products are carefully regulated and also ensure that they are not marketed toward young people. Thank you.
We hope you found this presentation from the content of Mayo Clinic Proceedings valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you will find access information for our social media content, such as additional videos on our YouTube channel or journal updates on Facebook. You can also follow us on Twitter. More information about healthcare at Mayo Clinic is available at www.mayoclinic.org. This video content is copyrighted by Mayo Foundation for Medical Education and Research.